Hello everyone. Today's video is about biofilms. Before I jump into the video, if you don't mind taking a quick second to please either like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying in the video should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So the question today reads, do I need to expect, oh my goodness, let me try again. What do I need to expect as a biofilm breaks apart, if it's there in the first place? How do I know if the treatment is effective? So thank you for the question. So what do I need to expect if a biofilm breaks apart? So basically, for all intents and purposes, there's two possible outcomes if a biofilm is breaking apart, if it is indeed there in the first place. One outcome is that a person, well, maybe three outcomes actually. One outcome is that the person feels better. They have fewer symptoms, whether that's fewer local symptoms like congestion or maybe allergy type symptoms, or they feel a reduction in systemic symptoms, whether it's brain fog, fatigue, neurological symptoms. Had a patient earlier today having a lot of eye symptoms related to mold in the sinuses. So eye symptoms, ear symptoms, skin symptoms. Mold can cause so many negative things or other things that live on biofilms. I guess, well, let me see here. The question was posted on a video about nasal sprays, biofilm disrupting nasal sprays. So sorry, for context here, we're talking about nasal biofilms here. For intestinal biofilms, it would be the same kind of answer, seeing improvement in symptoms. In that case, it would be probably more digestive tract related symptoms, but could be systemic symptoms as well, like joint pain and fatigue and things like that as well. So when a biofilm is breaking down, I'm expecting an improvement in symptoms that had otherwise been, plateaued. Oftentimes the course of action will be the antimicrobial treatment that was going up the nose for sinus biofilms, or down the intestinal tract for intestinal biofilms, or maybe taken, like getting into the bloodstream for treating systemic microbes, is going to be helping to kill off the microbes that are out in the open in those areas. But then if symptoms improve but then hit a plateau, then that's when the clinical clue could be a clinical clue that we're dealing with biofilms. So there should be hopefully further clinical improvement when those biofilms are being broken down. Another possibility is that as a biofilm is breaking down, a person could expect to feel worse. They could have more symptoms if there are more microbes coming out of hiding from those biofilms into the open, if their numbers are higher than what the person's body can deal with. If it's, just got to close my computer before it dies here, reading off my laptop, recording on my phone, got my technological savant, basically, just amazing. If the microbes are coming out of the biofilm at a faster rate than the body can deal with them, like faster than the immune system can clobber them, or faster than the antimicrobials the patient's working with can kill off those microbes that are coming out of hiding, then the person is likely going to feel worse, hopefully mildly, hopefully temporarily, but that would be another thing to potentially expect from the biofilm disrupting process. The third scenario that could arise if the biofilm is being broken down, if it's there, is the patient might feel no different whatsoever. Those biofilms might be empty. Maybe it was formed and then the microbes were all killed off, because there are antimicrobial agents, be they pharmaceutical or natural, that have been shown to be able to penetrate into biofilms and kill off microbes within a biofilm. So it's possible that if a person's been marinating themselves with enough antimicrobial treatment, there might be biofilms left behind, but everything's been killed off inside. So a person might not feel any different whatsoever, killing off or breaking down that biofilm and getting rid of it. So I believe the other part of the question, I've closed my computer because if I open it, it's just going to die. I believe the other part of the question that I read at the start of the video was, how do we know if the treatment has been successful? And the way you would know that it was successful is if a person is feeling 100% better, it's probably successful in that case. Or if the patient was feeling worse with the biofilm disrupting process, then say the dosage of the biofilm disruptor was lowered down, built up more gradually, and eventually got to the point where they're not feeling worse or wear from that biofilm disruptor. So the kind of absence of flare-up symptoms would also be an indication that the biofilm's been addressed. Unfortunately, not everybody feels better when they break down biofilms, even if they are there, even if they are inhabited by microbes. So unfortunately, sometimes it's oh, I'm flaring up because I'm breaking down the biofilms too quickly. So I go down to a pace that I'm tolerating. I get rid of the biofilm, but then don't actually feel much better because it may be that the biofilms are only housing housing microbes that are at a low enough level that they're not actually causing problems unless we're specifically bringing them up out of hiding and then rustling the bushes too much. So when it comes to biofilm disruption treatment, it can be really, really important. I've had many patients over the years where, whether it's been sinus biofilms, intestinal biofilms, systemic biofilms in, say, the joints or the vascular system, that have really improved when they went on biofilm disrupting treatment, but it's definitely not every patient. And I have had a number of patients where they've flared from the biofilm disrupting treatment. We eventually got them to tolerate the full treatment, but it didn't really move the needle all that much in the right direction for their case as a whole. So it's one of those topics that's really important, in my opinion, for clinicians to know about it, because it can be a really important thing to treat, but it's not always a super eventful, super clinically doesn't lead to symptom resolution in everybody, or even symptom improvement in everybody. If a patient comes to my office and say they test positive for SIBO or large intestine bacterial overgrowth, and they have digestive symptoms and whatnot that are likely related to SIBO, I have a pretty strong, a pretty high level of expectation that the patient is going to feel better when we start addressing that SIBO through diet and herbs and whatever it is that we use. Patient comes in and we're at the point where, okay, it's time to start breaking down biofilms. It's not the same level of confidence that I have going into, say, like a SIBO treatment, or a patient who clearly is dealing with a heavy metal overaccumulation issue, or a patient who's clearly dealing with an infection like Lyme or Bartonella or something like that. Like there's I have quite a high level of expectation that the patient's going to feel better given the right treatment. With biofilm disruption, it's just harder to predict whether it's going to make a difference or not. But again, it's very important in some cases, and it's just hard to predict out of the gate whether or not it's going to make a difference or not. Usually within a month or two at most, we should have a pretty darn good sense of whether the biofilm disruption treatment is going to be helpful for the patient. So it's not like you have to commit to, a patient has to commit to, say 6 to 12 months of treatment, but it still can be a decent amount of time commitment, because I think a month or two is a significant period of time, but it is all relative. Thank you again for the questions. I hope that answered your questions. If you have any further questions on this, just post in the comment section below. If anybody else listening has questions on this topic or anything else, please post in the comment section below, and I will do my best to answer as soon as I can.